All right, good afternoon and welcome everyone. We're just going to wait a few more seconds while the rest of our attendees file in. We have a very large audience this afternoon. Thanks for bearing with us. We do still have attendees filing in. Okay, thank you everyone for joining us. We're going to get started here. My name is Greg from the State Education Resource Center. Thank you for joining us. Just a couple of housekeeping notes as we begin here. This is a webinar as opposed to a Zoom meeting, which many of you may have been in on before. In the webinar, we have a couple of tools that enable you to get your voice heard. The most important one here tonight is the button that you will see at the bottom of your screen that's labeled Q&A. It looks like two speech balloons with Q&A beneath them. And that is the panel that you will use to submit your questions to our panel of physicians here this evening. The other control that you have is the raise hand button. If you click that, when we get to the segment of our presentation tonight where we are taking folks and allowing them to ask questions, raising your hand will be how we know that you want to be unmuted to ask a question. With that, I'd like to introduce my colleague Nitza Diaz.
Hola, voy a hablar en español solo para que sepan que la traducción está disponible. ¿Hay alguien aquí que necesita traducción? Si puede levantar la mano en el área de donde están los participantes, hay una mano azul que puede apretar y ahí me dice sí o no. La voy a chequear. Si usted, okay. María, Nicole, sí. Abajo en su video hay una, es como una bola del mundo y la aprieta ahí y pone español y ahí va a salir la traducción. ¿Me entendió? ¿Me entendieron? En el chat si me pueden poner si entendieron, entonces para decirle, para seguir en inglés. So I just asked them to tell me in the chat if they're not seeing the world map, the world ball. So they're not seeing that, Greg, for the translation.
I'm sorry, we may have to forego that. I don't have, it is switched on in the settings and
so
yeah, I apologize.
That's okay.
Apologies for the flub on the translation service, everyone. With that, I'd like to hand off to Dr. Knudsen from the State Department of Education.
Good evening, everyone, and welcome to Return to School Safety During COVID-19, a virtual house call session for parents and families with pediatric healthcare professionals. We're very happy that you have joined us this evening. Next slide, please. I should first say that my name is Stephanie Knudsen, and I'm the School Health Administrator for Connecticut State Department of Education. And in my role, I support school nurses, all the school communities, as in all things health. So this evening, the State Department of Education, together with healthcare providers, pediatricians, nurse practitioners, we're hosting this virtual house call session so that we can answer your questions, parents and families, about health strategies, healthy and safe strategies for school reopening. Next slide, please. And so we have a very short agenda because we want to be able to provide you parents and families with opportunities for questions and answers. So we will have some introductions. Each of our panelists will give a brief introduction so you can get to know your virtual housekeeping health experts. And then we're going to do a return to school safety presentation afterwards. So there will be introductions, return to safety presentation, and then the majority of time will be for you to ask your questions. Before we do that, I would like to first introduce our Deputy Commissioner of Education, Charlene Russell Tucker. Thank you so much for being here with us, Charlene Russell Tucker, Deputy Commissioner. This was your you really advocated for having this session for parents. And so we thank you for this opportunity.
Thank you very much, Dr. Knudsen. And hello, everyone. And thank you to this virtual house call. Parents, guardian, family members, thank you for joining us today. At the Department of Education, we recognize that you have many questions, and specifically about the health and safety related issues about planning for back to school. So it was important for us to make sure that we were able to talk with you, and more than anything else, so you're able to talk with our medical experts today. And I just really want to thank them. You'll soon have them introduce themselves, but thanks to this very distinguished panel of medical professionals who are sharing their time with us and with all of you to be able to answer questions. Thank you, Dr. Knudsen, for getting everything set up. And I also want to thank the State Education Resource Center for doing all that they could last minute today to make sure we were able to accommodate all of you. We thought we would be on a call with a couple hundred or so of you, and pretty soon we recognized that we were over a couple, thousand of you that wanted to be on the call today. So thank you, CERC, for making this happen. So sit back. You have great folks here to answer your questions, to which we're really appreciative that they're here with us. So thank you. Based on the overwhelming response, we know that you're truly interested. So I'm going to be quiet so we can get on with the program. Again, welcome and thank you for being here.
Okay, thank you so much, Deputy Commissioner. Next slide, please. And so let's start off. So why don't we start with Dr. Robert Dudley. Please introduce yourself.
Hi, and thank you all so much for joining us. I'm Rob Dudley. I'm a general pediatrician and the school medical advisor for New Britain, Connecticut. I am also the president of the Connecticut chapter of the American Academy of Pediatrics.
Dr. Ziogas?
I'm Barbara Ziogas. I'm a pediatrician in Farmington, Connecticut, and I'm also the chair of Connecticut's chapter of the AAP School Health Committee. I'm the medical advisor for CREC schools, the Farmington schools, and the American School for the Deaf. And prior to my career as a pediatrician, I was a special education teacher for 5 years.
How wonderful. And Suzanne Levasseur.
Hello, everybody. I'm Suzanne Levasseur, and I'm the supervisor of health services for the Westport Public School District. I'm also a pediatric nurse practitioner, and I've been in school health for about 25 years now. Happy to be here.
Thank you. Dana Eisenberg.
Hello, everybody. I'm Dana Eisenberg. I'm a pediatric nurse practitioner working in the developmental behavioral pediatric clinic at Connecticut Children's, my passion. Prior to coming to advanced practice nursing, I spent 22 years as an administrator and a teacher within independent schools as in a Montessori school.
And Dr. Collins.
Hi, I'm Mel Collins. I'm a pediatric lung specialist at Connecticut Children's. I'm the Associate Director of the Cystic Fibrosis Program. I'm the Director of the Pediatric Pulmonary Fellowship Program, and I'm an Associate Clinical Professor at the University of Connecticut School of Medicine. It's really a pleasure to be here today. I feel so special being able to come and answer questions and participate in this. So thank you very much.
And Dr. Ketter.
Hi, good evening, everyone. My name's Rob Ketter, and I'm a developmental behavioral pediatrician here at Connecticut Children's, and also assistant professor of pediatrics at the University of Connecticut School of Medicine. I work with children with all different types of special needs, and am a pediatrician who likes to promote the well-being of all kids on emotional and behavioral levels.
Thank you all so very much for being here. Our next slide, please. And so at this time, Dr. Ziogas and Dr. Dudley, I'll turn it over to you for this presentation.
Thank you so much. We're going to talk a little bit about the COVID-19, the virus that causes it, and also some safety issues that might come up as kids return to school. Next slide, please. So what is COVID-19? It's a virus, and if you remember, there's viruses cause many types of illness, including things like the common cold. The virus that causes COVID-19 is from a family of viruses called coronaviruses. And if you all are used to at this point, that sort of spiky looking virus that we see portrayed in the news, corona means a crown, and all of those little spikes that come out sort of look like a crown. There are many types of coronaviruses besides the one that causes COVID-19. And prior to COVID-19, many of those viruses were the cause of the common cold. It's one of the things that can with other viruses. In children, COVID-19 can really have a range of symptoms. So it can really go from everything from no symptoms and no illness to a mild cold-like illness to the severe life-threatening illness that I think we hear about a lot in the news. Older adults and folks with underlying medical conditions like heart or lung disease or diabetes are actually at much more risk for serious complications. Next slide, please. It's spread mostly from person to person through respiratory droplets that are produced when a person coughs, sneezes, or talks. And so when we talk about prevention measures, it's really aimed at sort of trying to prevent those little droplets. The droplets can land either in the mouth or noses of people who are nearby, or can be inhaled into the lungs. And spread is generally thought to occur mostly when people are in close contact with each other, so less than 6 feet. Next slide. So when we talk about COVID-19 symptoms, remember it comes from a family of cold viruses, so many of the symptoms that we see are cold symptoms. Fevers or chills, coughing, runny nose, shortness of breath or trouble breathing, sort of some flu-like symptoms like fatigue or muscles or body aches and headaches. Some other things that are sort of new, I think, with this virus are the loss of taste or smell that haven't suffered from before, sore throat, nausea or vomiting or diarrhea. And in children, I think the nausea and vomiting and diarrhea can be a little bit more prominent than in older folks. So basically pretty much anything. Next slide, please. So if you have COVID-19 or think that you've been exposed, the most important thing is to stay home, right? We don't want to expose other folks to the disease. For most people, COVID-19 is going to be a mild illness, and you can recover at home with the sorts of things that you would do for a regular cold. It's very important to reduce exposure. And that also means not leaving your home unless you're needing medical care. It's important to note, though, that most doctors' offices aren't seeing people with COVID-19 symptoms. So it's very, very important to call your doctor before going to the office. Just don't show up sick. It's important to get triaged by their staff. You might need to go to the hospital, or they might be able to provide advice over the phone. It's also important to stay away from public areas, grocery stores, malls, beaches, if you think you've been exposed or have symptoms of COVID-19 or have been diagnosed with it. Be sure to take care of yourself. the old advice from grandmas about staying hydrated, drink your chicken soup, right? Over-the-counter medicines such as Tylenol can help with symptoms like fever and body aches and help make you feel better. It's important if you have COVID-19 to stay in touch with your doctor. After you've gotten the diagnosis, let your primary care provider, either your doctor, your nurse practitioner, or physician's assistant, know that you've been diagnosed, and they will follow protocols sort of to keep in touch with you and help make sure that you're getting the right care. It's important not to get on places where you could spread the virus, such as public transportation, ride-sharing services like Lyft or Uber or taxis. You want to stay separate. And I've had some families where one parent gets COVID, and they sort of self-isolate in a bedroom and try and do as much social distancing as they can with the family. It can be very difficult. But keeping in touch with your doctor or your medical care provider is important. Next slide, please. So there are cases where COVID certainly can become a much more dangerous disease. And for folks that have real bad trouble breathing, persistent pain or pressures in their chest, if they're feeling confused or they can't stay awake or wake up with difficulty, or if they have signs of having oxygen problems like bluish lips or bluishness around their face, it's important that you contact your provider immediately or seek care in the emergency room. All of these slides have been taken directly from the CDC website for guidance for folks. And I think something that's important to understand with COVID is, as the disease, because it is a new disease, as we understand more about it, we're constantly adding information. So rechecking those sites, and Dr. Ziogas will share them with you later on, is important. If anything is bothering you, you have questions, once again, be sure to contact your medical provider. Don't go to the office directly. Reach out to them by phone, email, or by their website portals if they have them. Next slide, please. Something that we all know about trying to prevent the spread of COVID is also hand washing. So I think we've heard since early March or April, it's very important to wash your hands. Soap and water is the best way to get rid of germs, and especially COVID. The rule is to wash your hands with a good soap and water for 20 seconds. And if you don't know what 20 seconds is, humming happy birthday to you from beginning to end twice is a good approximation of the amount of time. You can also use hand sanitizers. It's important that they contain at least 60% alcohol. And if you check the ingredient list on the side, you can see what that percentage is. There are, unfortunately, when we had a shortage of hand sanitizers, there were a lot of products out there that did not have alcohol in them and wouldn't have been effective. So that's a key point, the 60% alcohol, at least on the product label. And I'm going to turn it over now to Dr. Ziogas in the next slide, please.
You're muted, Dr. Ziogas.
Thank you, Rob. I'm going to talk about masks today. The CDC is recommending that all people wear masks in public, and also wear them when you're around people who don't live in your household. There are a couple of things that have been recommended by the CDC, and one is that masks should not be worn by children under the age of 2. I believe that the reason for that is children under the age of 2 may not be able to remove the mask if they needed to. That's the concern. If they were going to throw up, it would be hard for a 2-year-old to undo straps and if it weren't just elastics over the ears. They also should not be worn by anyone who has trouble breathing, is unconscious, incapacitated, or otherwise unable to remove the mask without help from another person. I've been seeing some valves on some of the masks coming into my office. Those valves are not safe for other people. The primary reason to wear a mask is to protect those around you. You also get some protection for yourself. But when someone wears a mask that has a valve or a vent on it, none of their air is filtered. So they're breathing out any germs that they may have been harboring inside of them. So they're not allowed to be worn if we're trying to prevent COVID. Next slide, please. There are some really important things to remember when you're using a mask. And the first thing is we want you to wash your hands carefully before you put on your mask. We want your mask to be clean, and we want your hands to be clean when you're putting the mask on. The mask is supposed to go over your nose and your mouth and be secured underneath the chin. It does no good at all to be wearing a mask that's under your chin or under your nose. We would like the mask to fit snugly against the sides of your face, but it's very important also that you can breathe easily. If you cannot breathe easily through the mask, it's not a safe mask. So all those parameters must be met. Next slide. We want you to protect other people just in case you're one of those people who is unaware of the fact that they're carrying COVID and you don't want to spread it to other people around you. We want you to wear the mask in public settings, when you're around other people who don't live with you in your home, and especially when you're less than 6 feet away from another person. We want the mask to be worn correctly. If you're not wearing the mask correctly, it's wasting the mask. You really should be wearing it over your nose, over your mouth, over your chin, and snugly fit against your face. We don't want the mask around your neck. We don't want to see the mask on your forehead. And I see this all the time. People should not be putting their hands over the mask, over their face. That's where all the germs may be accumulating if you're breathing in or breathing out. If you happen to need to adjust your mask and touch the front of your mask, we want you to wash your hands or use hand sanitizer. And get used to using just the loops to take the mask on and readjust the mask or take the mask off. If possible, we don't want you to touch your face while you're wearing a mask. Next slide. So there are some do's and don'ts, and if you look at the picture on top, those individuals are wearing their masks correctly. On the bottom, there are people who are wearing their mask as a headband or as a scarf, or putting their hands over the part of the mask that we want to keep clean. We want to keep our hands clean as well. Next slide. So there's important information about taking off your mask. Untie the strings behind your head or stretch the ear loops. We only want you to handle the ties and the loops. We don't want you to touch the front of the mask. When you take the mask off, the mask may be full of virus. We want you to fold it inside out with the corners together and put it in the washing machine. If it's washable, if it's a washable mask. If it's disposable, throw it away. And we don't want you to touch your eyes or nose or mouth when you're taking off the mask. And as soon as you're finished taking off your mask, we want you to wash your hands with soap and water so that you don't carry any germs from your hands anywhere else. Next slide. Other important health habits are to stay away from people who are sick, and when at all possible, keep 6 feet of distance between yourself and other people. We want good hand washing to happen, soap and water for at least 20 seconds each time you use it, or hand sanitizer that has at least 60% alcohol in it. Next slide. Some important things for getting back to school. Many of our students have missed their checkups. We want you to check back with your pediatricians to make sure that your child's immunizations are all up to date. There are some required vaccines, and we want to make sure that we don't have an outbreak of any vaccine preventable disease. So please make sure that your child's immunizations are up to date before you get back to school. Most of us will stand on our heads to make sure that we completely immunize all of our patients before they get back to school. And this year, more than any other year, it's important to get an influenza vaccine. I don't know how someone would be able to withstand a concurrent or dual infection with both influenza and COVID. It would be terrible to have both diseases in a home at the same time. Please call your pediatrician and get back on track with your well child visits, and schedule those visits as soon as possible, because This is our very busy season, but we do want to see all of you if you need an appointment. Next slide. Here are some nice resources for getting back to school. Connecticut Children's has offered some very wonderful information to both pediatricians and patients. And I also want you to look at the CDC website because there's very easy to understand important information about getting back to school. Also, we have wonderful information through the American Academy of Pediatrics at healthychildren.org. And these are all trusted, reliable sources where you get the kind of information that's accurate and up to date. And thank you. I'll turn the presentation back to Stephanie.
Thank you so much, Dr. Ziogas and Dr. Dudley, for that information. And so we can go to the next slide. And so now it's time for question and answers from our parents. And so some of the questions that I have seen in general, I've been reading through the chat box as well as questions that we received ahead of time. And we have some themes that we see several parents are concerned about. So I'm going to start with you, Dr. Ketter. As parents are sending their children back to school, we have several concerns about children wearing masks, children seeing other people in masks, the social emotional aspects. They want to know about how is this going to impact my child social emotionally? Is my child going to, how is this a risk for my child, seeing everyone in masks? Can you talk a little bit about that and maybe give us some strategies about what parents can do before school actually starts?
Sure, absolutely. I think the challenge that masks present is that we all are accepting that it's the new normal and it's what we have to do in terms of being safe. So helping children understand that it's part of the new normal and making sure that you're checking your own stress reaction at this first is a really good first step. But the good news too is that for the majority of kids, we can help train them to learn how to wear masks and to do it for longer periods of time. I think that there will always be a few children who have very complex needs that might have some difficulty, but that's on a case-by-case basis. The good news is that the majority of kids do learn how to wear masks and they can make it fun. And this is something that we're trying to help them do. So I think what's really important is help your child understand what this is and why we're doing it and how it's having a really nice impact. We've seen the numbers in Connecticut really drop because everybody here is doing their part in masking and being safe.
Thank you for that. And from a pulmonologist standpoint, there are many questions about asthma and wearing masks. Dr. Collins, can you talk to us a little bit about that?
Yes, children with asthma should be more than capable of wearing a mask for the school day. They're really, much of it is a developmental issue, getting used to having the facial covering on your face, but only someone with extremely impaired lung function would need to not wear a mask. And if your lung function is that impaired, you probably shouldn't be going out in public. If we look at our guidance from our adult colleagues from the American Lung Association, they actually give instructions for adults who require oxygen on how to wear their nasal cannulas beneath the masks. So as a group, we really stick strong with wearing masks to protect and we don't leave in mask exemptions for children with respiratory disease.
So, and I want to make sure that our parents, because there are many, many questions about this, Dr. Collins. So some of the questions are concerned about, you know, children may have, they're going to be wearing masks for 6 hours, you know, or more sometimes between the ride to school on the bus and the ride home. So 6 or 7 hours maybe. And we're talking about children from kindergarten. Sometimes some school districts have preschool children all the way through grade 12. And so we have parents who are concerned that my child has really bad asthma. So are you saying that if children are able to go to school, ride the bus, walk around, wearing masks are safe? Can you talk a little bit about that?
Yeah, I absolutely think wearing masks are safe. And you know, the The big reason why you wear a mask is to protect other people, but you can get anywhere from about 30 to 20% of protection for yourself by wearing just a nice cloth face mask. So I really think that we have to have mask breaks. And I have great confidence in our educational system. I think everybody recognizes that this is a significant public health emergency. I think schools really want to work with patients and families to find the right balance for each person. But the key for us as parents is making mask wearing a normal part of life. Practice while the kids are watching television. Really encourage people to stay calm with that mask covering over their face, because anxiety can actually do a lot more to your breathing than well-controlled asthma does.
And this is such great pieces, and I see Dr. Ketter nodding away, and I'm also wondering, Dana, to add in. So this is great conversation, because I see that in the chat as well. And I also want to push in on what are other fun things that can be done, that guidance that we can give families to say, make this a game. How do we learn to do this, especially before school starts?
Yes, Dana, go ahead.
See, Dana, yeah.
Sorry, unmute. I think that, especially when we're talking about younger children, we have to remember that very young children can sometimes be afraid of masks, right? Watching other people wear masks, because they need people's faces. And we need to remember from the child's perspective that that can be frightening. And as with almost everything in a young child's life, it's the parent that is the guide. So when we're talking about mask wearing, it's very important to use very simple words to explain why we're doing this, right? And to give time for the children to look at the masks and explore them, answer questions that they may have, but in very simple ways, and give them support if they're feeling anxious about it. There's a lot of wonderful social stories out there that are very simple stories to help children understand why we social distance, why we wear masks, that can be very comforting to them. And you can have a lot of fun with masks, right? You can play different things with them. You can decorate them to make sure that they're safe. But again, handling them, as Dr. Kidder was saying, in a way that they become less of a strange thing and more of a way of life. It's very important for children to understand that.
Yes, and Dr. Kidder.
And to add, so I think we are all in agreement that if you are going out in public or you are going to school, you have to wear a mask. But like everyone's saying, kids can be trained, and it's really amazing how resilient and how much change kids can make. A lot of times what I've encountered is that sometimes as adults, we become so anxious that we can't get past the thought that the child can do it, and kids really surprise us with what they're able to do. But the good thing about this is exactly like Dr. Collins mentioned, ask them to start wearing it while they're watching television or playing a video game, and make a game out of doing it itself. If they can wear the mask for a half hour before they have to take a break, can we get to an hour after that? And then can we get to 2 hours? And can we, over the next couple of weeks, work our way up to 6 or 7 hours of wearing a mask? And what's really neat is kids impress us all the time with what they're able to do. So I'm really excited because, kids are really stepping up, and we want to invite them to continue stepping up by doing this. But acknowledge it's different and it's hard, which means we're going to give them a lot of praise and rewards, because kids don't fully understand that there's a pandemic going on, but they're responsive to stickers and praise and other things that let them know that they're doing a great job.
Okay.
So someone in the chat said, I don't think the kids are going to be the problem. So what are you sharing with your parents in your practices about helping them kind of adjust to this new world?
I tell my parents that they need to mask as well, that they really need to set an example. As a pulmonary doctor, many of the isolation and masks is not a new thing. Many of our families have been wearing masks for years to prevent the spread of disease and keep their kids safe. One new thing that I have started doing at work is I do open the door to the exam room while I'm putting on all of my precautions so that the kids can gradually see me change from Dr. Collins to Dr. Collins the minion, because all of our gowns are yellow, crazy shield. So I think that, you know, for teachers, my daughter's teachers always sent a note to welcome them to the first day of school. You know, sending pictures of yourself before the mask and after the mask, or a parent showing kids that it's still the same person, I think is really important.
Thank you very much for that. Yes.
Right, and I know Stephanie has another question. And just for our folks in the audience, I know somebody said, when are you starting to ask the questions? So these are the questions that we've been going through, and there's a lot of question on mask, which is why we're spending a little bit of time there. So we are indeed in the questions. Stephanie, yes. Another question?
Yes, and just so you know, my computer is trying to restart, but I'm going to go ahead and try to force it not to. So there are a lot of questions about symptoms of COVID and the likelihood of children having symptoms for things other than COVID. And so can Dr. Ziogas, can you talk to us a little bit about children may be having a temperature, children may just sneeze because they may have allergies, seasonal allergies, and talk to us a little bit about that and COVID.
Each of the school systems is developing protocols and working closely with the Department of Public Health and working with the nurses in the health department to be able to make some determinations about a child who might have allergy symptoms or asthma symptoms versus the child who might have a new viral infection. There are some very specific recommendations for nurses. They're actually not being given a lot of leeway in terms of that. If there is, at this point in time, if there's a new onset of cough or runny nose, the nurse is now directed to speak to the pediatrician or physician about those symptoms to determine with the pediatrician whether or not this is a new symptom or a part of allergy or part of asthma versus whether this needs further evaluation. So they're developing some protocols. They're changing day by day. They're becoming more and more refined, but they will have some very specific recommendations. It's important that we keep kids in school if they can stay in school and not confuse allergy, runny nose, and sneezing with COVID. And they're working hard to tease those issues apart and work with their physicians and pediatricians in the meantime.
And Sula Vassar, working with students, and can you help talk a little bit about some of the supports that school nurses can provide children who may become sick during the school or who may develop some symptoms while they're in school? Can you talk a little bit about that?
Sure. So the health office in school may look a little different this year than it previously has. School nurses have been taking part in educational things throughout the summer to be prepared for this. As Dr. Ziogas said, we are giving clear guidelines of really how to manage a student with a certain set of symptoms. Certainly there'll be clinical judgment. A student will come in and be assessed by the school nurse. The school nurse will look at the symptoms and determine whether this could be a sign of COVID, working by protocol, and then would immediately isolate the student. So in health offices in Connecticut, in schools right now, you know, we are gearing up to have isolation places for the safety of all our students where that student can be isolated, sent home quickly, and clear guidance can be given to families about next steps. So that's been a question that we've all had. And you know, that will be determined based on the symptoms they show. We may recommend testing and can give families clear guidance on when your child can come back to school, to reach out to your pediatrician and how to proceed from there. In addition, the health office is prepared to do a lot of training. School is going to look different for staff as well. So reinforcing these healthy behaviors for staff, helping staff learn, work with students, knowing that mask wearing may be a challenge, and also doing a lot of education with our students that, about these healthy practices. And I would like to echo everyone's comments and also just encourage parents to talk to their children about how school may look different, and answer those concerns and explaining it in simple terms so that they are more prepared when they come back.
And I know there's a question here, and thank you for that, from Barry Rosen. In the question said, why are you recommending the flu shot if it doesn't protect against COVID-19? I don't know who wants to take that one.
Okay.
Go ahead, Dr. Dudley.
So I've seen a bunch of questions about the flu shot. So we do what we can. So we know the flu is a very serious disease. Many children die from it every year. It's also something we can help prevent by getting our flu vaccine. I've seen a bunch of questions pass by about when's the best time to get it. So normally I would say yes, later in the fall. But during this season, when we don't know when the flu season will start and we know that COVID is out there, I actually have given 5 or 6 flu vaccines today. So they are available. The Vaccines for Children program has been distributing them, and they will be coming into pediatricians' offices because we really anticipate a very high demand for the vaccine this year. I would say if you can get it in your doctor's office for your preventative care, get it now. Don't put it off, because we really don't know each year when the season will start. We frequently have years where early fall, the flu strikes, and we haven't distributed much of the vaccine yet. Other years it comes later in the spring. It's felt that there's a peak to its effectiveness that lasts 3 or 4 months, but certainly you get some protection no matter when you get the vaccine.
Also a question, thank you very much, Dr. Dudley. If our child shows signs of COVID, this is from Nicole, what do you do? I think you spoke a little bit about that earlier, but did somebody want to just reinforce? If parents have children that are showing signs, what do you do? Who wants to grab that one?
I'll grab that one. Every school district has a protocol for what happens for a child that might be showing signs of COVID. Most of those students will be isolated and sent home. They usually are not going to be in the same health room with kids that might be coming in to get their diabetes care or routine medications. They're probably not going to be mixed in with other kids that have scraped knees or bumped elbows. They'll be in an isolation room and they'll be sent home. That's pretty much the standard for all the school systems, but every school system has their own plan and they follow the Department of Public Health's protocols, which continue to be refined and defined daily.
I would also like to jump in and encourage families, if your child is home and your child is ill, to notify the school nurse and the health office, because we will be tracking that. I think one of the important roles of the school health office will be doing surveillance and keeping track of how many children are out of school and with what symptoms, so that we can have easily and early identify trends and share this in a collaboration with the health department. So that's something else that I would stress, that you get to know your health department and have that easy collaboration so this information can be shared.
I would also add to that recently the Department of Public Health released a document on these scenarios and what to do. And I don't know if we can put it in the chat, Stephanie, but it's if an individual has COVID symptoms but has not had close contact to a person diagnosed, if you're at home, what do you do? If you're at school, what you do? If you're on the bus, what do you do? Those kinds of things. And that document is out there and available for all to see what protocols have been shared with districts as well. All right, some other questions, Stephanie.
We have one, Stephanie.
Did we lose Stephanie? Okay.
I actually saw a lot of questions about face shields in school. So I wear a face shield every day when I see patients. some of my colleagues are goggles, and that's actually a standard at Connecticut Children. So every barrier that you can put between yourself and those little aerosolized droplets is great. But I do think that we have to be mindful of the activities that children are doing in school. I work in a fully air-conditioned hospital. Not all schools are fully air-conditioned, and the addition of the goggles or the face shield can make things a little bit steamier. I also, and maybe Dr. Ketter can talk about this, but you know, I wouldn't want my kid to be the only one with a face shield in the classroom or the goggles and make them feel uncomfortable. The goggles especially do fog up. So I think, you know, this is a very individualized process for every child and every family. And you kind of have to arrive at the combination that works best for you.
Thank you for that, Dr. Collins and Dr. Ketter. In the chat, there was also concerns about mask shaming that could be taking place in school as well. So can you talk a bit about that?
So I'm happy to talk a little bit about mask shaming. I think that this is a real challenge, and when it comes to the concept of shaming with masks, we really want to reframe this, because wearing a mask right now is just as essential as wearing pants or a shirt or shoes. And those are things that we've all learned to do, but right now, because it's a pandemic, we do need to wear the mask. What we want to teach kids is that we're being good citizens by helping one another, but that we're being understanding that some kids might have a little bit more trouble. So mask shaming would be kind of similar if you've heard the term fat shaming, or like bullying, that someone makes fun of someone or points out and does the whole like, ooh, they're not wearing a mask. The challenge, and part of the reason why Connecticut's done well, is because we've all signed up for this big social group contract saying that we agree wearing a mask is important. And by doing that, look, we're really leading the country in terms of where our numbers are going. So I think we really want to help kids understand that if somebody drops a mask or something happens, that accidents happen, but we're here to not police one another, but encourage each other to keep stepping up and do it. I would be concerned that if there are teachers who have health concerns that they can't wear a mask, that being in school for teaching right now may or may not be the best option for them. And the same for students, as Dr. Collins had mentioned earlier. But we want to teach kids that we're not doing this to be mean, we're not doing this to make fun of one another, that we're all in this together. And by stepping up and doing this together, we're all helping out. And being kind and patient is really the most important thing that we could do right now, especially when everybody's a little bit anxious about all the stress caused by the pandemic.
And Dr. Ketter, you said something which is important, and it goes along with a chat that was just written in, that I do know schools are preparing to have extra supply of masks if necessary, so that they can fill in that space if something happens. You know, you lose your mask or things like that. So we don't get involved in to the point of what you talked about earlier. Another question, and thank you all, I know you're monitoring the chat as well, issues around mask breaks. And I don't know, Sue, if there's conversation going on in your district about how do you get kids to have some time to kind of just breathe without the mask, and anybody can jump in here too. But Sue,
Yeah.
we can get started.
I think mask breaks are an active conversation probably in every school district. We recognize the importance of that, and looking at particular times in the classroom, certainly when we can social distance beyond 6 feet, ideally outdoors, certainly during lunchtime, again, optimally social distancing beyond 6 feet. We know that masks need to be off when students eat lunch. And being creative about what points in the classroom and what points of the day during PE and other times that those mask breaks can be done. But they are certainly essential and important, and will be weaved in throughout the day.
These conversations are ongoing. Every day we're talking about them. Today I was talking with the nursing supervisor for one of my school districts. We wanted to give teachers in our school district the opportunity to know when the kids needed the breaks. We recommended, I think the recommendation was at least 5 minutes every hour. We talked about breaking the classroom up into groups that were 6 feet apart. So kids might be the red group, the yellow group, the green group, or the blue group, and the blue group can take their mask off for 5 minutes. And then the yellow group, so that the kids would be at least 6 feet apart when they took their mask off for a break. We preferred outdoors rather than indoors, but we didn't say that the teachers had to stick to any particular time frame for masking. Because there are times that it's hot in the classroom, there's no air conditioning, as Dr. Collins said, and especially the young kids, they just can't tolerate some of that. They're going to have fatigue and they're not going to learn. So we wanted teachers to have some leeway. We wanted to keep people distance, maybe not have all the kids have their mask off at the same time in the classroom. So we're actively working on that and thinking about that, and I believe the state is going to come out with some more guidance tomorrow about masks and breaks in the classroom.
Thank you very much. I should also share Dr. Ziogas and Dudley, they're both school medical advisors. And Dr. Dudley, could you just share a little bit about school medical advisors are also there, a part of the conversations, as was mentioned before, as folks are really struggling to make sure that they address all these issues.
So I think the role, getting a little bit of feedback. So as a school medical advisor, I'm working very closely with the lead district nurse who, and also the Department of Public Health. So I think it's a very important thing to understand as schools plan their reopening, there's a great deal of conversations going on between different departments. Part of those roles, and I've seen a couple of things asking about contract tracing, is defining who within the Department of Public Health or the Board of Education is going to be handling each part and making sure that each of the different roles is communicating with the other. It's a very long, sort of drawn out process, and we're all trying to plan for all of the possible contingencies, even as new information comes in, and then we have to redo the plan and up it. I think you can rest assured, though, that the state, at the state level, between the State Department of Public Health and the State Department of Education, is providing these sort of best practices guidelines for districts as we go forward.
And thank you for sharing that, because even though you may not have your specific questions answered, we will be looking at all these questions to help inform policies as we go forward, recognizing how important this is to you, and making sure that you've got confidence in the safe return to school.
Charlie,
yes.
Can you hear me? I also noticed that there are several questions about if a student is sick or a child is sick, what is going to happen in certain protocols and policies. So as one who is working in the school district, what kind of protocols and policies do you have for when a student is sick to help parents better understand what happens and how would that work?
Okay, I think I addressed that a little bit before. Stephanie, you might have been off screen.
Thank you.
I'm happy to elaborate. I mean, I think that I just really shared that nurses are prepared. The State Department of Education, as well as the DPH, have given us nice guidelines that we followed, that we can follow to help inform. We have the capacity to isolate those students, quickly get them out of the school, and help advise parents. So really just as a measure of reassurance for our families.
There is a question
yes,
that was just asked about not being allergic to eggs and not being able to take a flu shot. Any one of our docs want to take that? Go ahead, Dr. Collins.
So I can actually speak to that. Because actually the recommendation is that many children who have an allergy can receive an influenza vaccine. I would also say, the question was also about opting for distance learning. So I think that's a really tough question for patients and families, and that is a theme here. I saw someone who's an elderly grandparent, you know, bless your heart, who's taking care of your grandchildren. There's a really great checklist on the Connecticut Children's Medical Center website, and a really nice discussion by Dr. Salazar, who is our chief of pediatrics, that talks about how to kind of weigh all of these options within your family to determine if a remote learning option or an in-person, be it hybrid or whatever learning option, works best for your child and your family. I personally found it very helpful for myself in deciding what I needed to do.
Thank you so much for sharing that. We also have a Q&A on our department's website about opting into remote learning and the kinds of things that you need to be considering. So thank you for sharing that as well. Dr. Ketter?
Just to reemphasize, I agree with Dr. Collins. If you look on the Connecticut Children's blog, you'll find a really nice, well-written post by our chief physician, Dr. Salazar, who is an infectious disease pediatrician. And I think that the decision to consider remote versus in-home learning is a complex one that really should be decided on an individual child-by-child basis. And it's not just taking into consideration your child's needs, but it's also taking into consideration your family's needs. If you have somebody that you're concerned could be vulnerable at home, that's something to take into consideration, but you need to weigh it against how realistic and or effective could remote learning be for your child. If you have a child with special needs, that might be something to think about, because the benefit of being at school is they have access to services. The challenge of being at home, while it might be safe, is it might be harder to engage the child, and that might mean that it needs a little bit more parental support in terms of being able to do that, but that's a family case-by-case basis. So I know a lot of people are in the chat writing questions about, what about my child with this medical condition, or my child who's anxious or might have panic attacks? These are really questions that we can't answer because we don't know your specific child. But what I would do is encourage you to call your child's medical provider, whether it be their PCP or a specialist that you work with, because they know your child and they can help guide you on these decisions. But remember, we're here to be guides, and ultimately this is a decision that you as a family are making with your child. But I really am happy that we are all working together as a group and a society to really put the best foot forward on working on this together.
And I'm curious about, yes, and I'm curious about Dana, from your perspective as well, and from having those experiences in schools, from what the conversation in the chat that you've been able to see or hear, is there any advice that you could give to parents in helping them prepare their children, just from what you're hearing, prepare their children for school?
Yes, absolutely. I think that, like we've said from the beginning, it's very important to understand what is going on at your school first, right? All schools are handling things a little bit differently. And to have some really nice conversations with your children before they're going to school and for preparation for that. And start with some of your children's questions. Your children are wonderful leaders in terms of guiding what they're worried about, what they're thinking about, what they're hearing. And from those, you can then take their cues and answer their questions. There's nothing more important than the conversations we have with our children, and we are their most trusted people in their life. So they are going to believe what we say, and that is a huge responsibility and also a gift. So having those conversations early, starting with our children, their questions, providing simple answers is very important.
Thank you for that.
And I would also add, thank you, and I know we're getting to almost that time, but I saw questions in the chat about questions on heating and ventilation, also on cleaning and disinfection. And on our website, we had 2 recent webinars that was done by Department of Public Health, Yale School of Public Health experts on these topics. And so the webinars were recorded and they're there as well, that you can download along with the PowerPoint that was a part of that presentation. So, and they answered a lot of questions, and I think you'd be interested in those, and that is available as well.
Yes, and I do notice as well too, we are at the top of the hour. And so while there are so many questions that parents have, we do notice that there's some very specific questions about what is going to be happening in a school building, in a particular school. What are the plans that some school districts may have? I would encourage you to look at your school district's website, stay in touch with your school district leaders around what are some of the more detailed, specific information and plans that your school district may have in terms of preparing your children to go back to school, as well as also you preparing to go back to school, because we're all going back to school. As Charlene said, for your information as well, this session has been recorded, is being recorded, and we will provide the link so that you can have the information. Alongside that link, we will have the information so you can access the ventilation webinar that Charlene just spoke about, as well as the cleaning and sanitizing webinar that the Department of Public Health has put out. There's also another document that is a collaborative document from the State Department of Education, as well as the Department of Public Health, with input from health experts and school folks as well, about the different COVID scenarios. What if my child was exposed to COVID? What if my child was not exposed to COVID but may have symptoms? What if my child does have symptoms but doesn't have COVID? Should my child get tested? What if the testing is positive? What if it's negative? What will happen? That document is a table, and it provides you with some answers to those specific scenarios as well. We'll include that information for you so that you can have that information to look at. And so we are at the top of our hour. Charlene, maybe we can ask each panel member if you have a closing thought. What would be something you'd like to say to parents? Maybe we'll start with you, Barbara, Dr. Ziogas.
I very much understand the fear that parents have sending their kids back to school. And I can honestly say that I have been all over the place. First worried and thought the kids shouldn't go back to school, and then maybe they could go back to school. But I'm very confident in the Department of Public Health, and in particular, Dr. Lynn Souza. They are monitoring the infection rates in Connecticut very well, and we're doing a really wonderful, wonderful job. I think last week it was less than 0.5% of tests being done in Connecticut came back as positive. And so we are in a good place for the kids to go back to school, and I'm feeling, even though I was at one point still not sure that the kids should go back to school, I'm feeling so much more comfortable. And yes, the Department of Public Health and State Department of Education have done a beautiful job at putting together wonderful protocols, and they're going to do all that they can to keep kids safe, and we're going to work with you too to keep your kids safe.
Dr. Ketter, final thoughts?
I know that this is definitely continued uncertain times, but we've learned a lot over the past several months, and I think that the first and most important thing is to take a deep breath and acknowledge that there are some things outside of our control, but that all of these decisions are evidence informed and evidence based, that the state is being very responsive to where numbers are, and that these are not just decisions that are being made willy-nilly. And remember that this is happening and improving because everybody here is doing their part. So keep doing good work, keep helping. Remember, we are all contributors to our own school climate, and now more than ever, school climate has become very real in terms of health. So do a good job about keeping up, encouraging your child to wear their mask, wash hands, and keeping your child out of school if they're sick, and pay attention to how we can help everyone, because this is an issue of both public health, safety, and equity.
And Dr. Dudley.
Thanks. So I think it was mentioned before, we've sort of formed that social contract that folks are wearing masks and have done the hard work to limit the spread of this infection. And now sort of the reward is that our children have an opportunity to get back to school. Having sat on many committees with Dr. Knudsen and Commissioner Russell Tucker, it's pretty obvious that a lot of hard work is going into this. Data is being collected, and the sort of decisions that are being made are very much based on the best information that we have, and a lot of hard work and a lot of data to observe. I would encourage everyone to participate that can, and as you make those very hard decisions for your family, that you continue to look information and keep up on the information, look at the websites that we've provided, and we're all going to be going through this together, and we're going to stick together.
Nurse Practitioner Eisenberg.
We are, as human beings, essentially social beings, and that is one of the more difficult pieces for all of us at this time. There is underlying fear, there is underlying worry, and we also see a lot of beautiful care and wisdom and collaboration. And I would encourage us all to continue to find that. We are all in this together, and we have a wealth of resources, and we should lean on each other and take good care of each other at this time.
And Dr. Collins.
I just want to reassure parents that you have been making decisions to keep your children safe and aid in their development. Many, some of us for 11 years like myself, and many of us for even longer, some just for a short time. So you just have to apply the same knowledge and wisdom that's in your heart. Again, I loved the checklist. It didn't really tell me anything that was different than my heart, but you can do this and you can make your children successful no matter what option you end up taking. We really can make this successful. We're going to regroup, and we're going to be this ingenious group of people who modified to fit around COVID. It's going to be okay.
Yes. And past president of the Association of School Nurses of Connecticut, as well as Westport's nursing supervisor, nurse practitioner Suzanne Levasseur.
I would just remind families that there are a lot of supports that the school have. A shout out to my school nurse colleagues, also school psychologists, school social workers, and the educational staff. Everybody has been working so hard this summer to put things in place to keep kids safe, not only physically, but mentally. Social emotional learning is in progress, and all those things. So, and I would also like to remind parents that they are partners with us with keeping their kids healthy. A lot of things were mentioned today: immunizations, staying up to that, getting the flu vaccine, child checkups. We know that it has been difficult, but I think it's a lot more accessible now. Avoiding travel at least 2 weeks before going to school, so that we have kids in school that have not traveled. That's very important to abide by as well. So, we are partners in this, and I'm looking forward to a good school year in spite of it all.
And Deputy Commissioner Charlene Russell Tucker, please.
Well, thank you. And there's a last post here that says we're all in this together, and nothing is more poignant and shows by the gathering that we have here on this call, and because we care. It was really important that we get a chance to talk directly to families, because we know that they're fears, and we're working as hard as we can to make sure we can unearth those. We hear you, and we are indeed in this together. We're working to make sure schools are prepared. We have a webinar, 3 webinars coming up next week that we're inviting districts and local health and our medical advisors and nurses to attend. One of them is on mitigation strategies and community spread and decision-making, right? Continually evolving. There's another one on how to prepare your school water systems for reopening. And then there's one on case management, testing, and contact tracing. So I share that just to say we're doing all that we can to make sure our school districts and decision makers have all the best information. And we are partners with pediatricians and those that are not a part of the bureaucracy, because it is going to take all of us working together. So thank you for our colleagues who share their time so generously to answer your questions, and for all of you in the audience that took the time to join us. As someone said, we're in this together, and together we will get through this. So thank you all very much. Be safe and be well.
Thank you. And I'd like to say good night. Good night to everyone. Good night to parents and families as well. Take care and have a safe and successful school year. Good night, everybody.
Thank you.